What if your low sex drive isn't because of stress, age, or relationship problems, but because of high blood sugar silently damaging your body? Many people with diabetes notice a drop in libido. They ignore it, thinking it's temporary. The truth is, low libido can be an early warning sign that diabetes is affecting your hormones, nerves, and blood circulation. If your sexual desire is decreasing, this video could help you understand why it's happening, and more importantly, how to naturally improve it. Low libido means reduced interest in sexual activity. It can happen occasionally, which is normal, but when it becomes frequent, it may signal an underlying health issue, especially diabetes. Diabetes doesn't just affect blood sugar. High glucose levels damage nerves. They also reduce blood flow, disrupt hormones, and increase fatigue. All of these affect sexual desire. Many patients don't realize that low libido is often the first stage before other sexual problems appear. That's why early awareness is important when blood sugar stays high for long periods. It damages small blood vessels. These vessels deliver oxygen and nutrients to different organs, including the reproductive system. At the same time, diabetes damages nerves, a condition called diabetic neuropathy. These nerves play a major role in arousal, sensation, and sexual response. When nerve signals become weak, desire decreases. Another important factor is reduced nitric oxide production. This chemical helps relax blood vessels. In diabetes, nitric oxide levels drop, leading to poor blood flow and reduced sexual response. Hormones are also affected. Many men with diabetes develop lower testosterone levels. Low testosterone directly reduces libido, energy, and motivation. When you combine nerve damage, poor circulation, and hormonal imbalance, the result is often low sexual desire. Low libido in diabetes doesn't happen suddenly. It develops gradually. You may notice less interest in intimacy, even when you previously had a normal sex drive. Some men also feel less excitement or arousal during intimate moments. Another common symptom is mental disinterest. Even when the opportunity is there, the desire is missing. This is different from erectile dysfunction. Here the problem starts with desire itself. You may also experience increased fatigue. Diabetes can cause tiredness, and when energy levels drop, libido naturally declines. Some men also report mood changes, irritability, or mild depression. These psychological factors further reduce sexual interest. Sleep problems are also common in diabetic patients. Poor sleep lowers testosterone and reduces libido. Here are some early warning signs you should not ignore. Reduced interest in sexual activity compared to your normal level. If you previously had a healthy sex drive and now feel indifferent, this may be an early sign. Lack of spontaneous sexual thoughts is another indicator. When libido is healthy, desire comes naturally. If that disappears, it may indicate hormonal or nerve-related issues. Reduced morning arousal can also be a warning sign. This often reflects declining testosterone levels and poor circulation. Some men also notice emotional disconnect during intimacy. You may still engage in activity, but the excitement feels lower than before. Another early sign is needing more stimulation than usual. This happens when nerve sensitivity decreases. These signs often appear months before more serious sexual problems develop. Recognizing them early can help prevent progression. The good news is that low libido in diabetes can often improve with the right lifestyle changes. The first and most important step is controlling blood sugar. Stable glucose levels help protect nerves, improve circulation, and restore hormonal balance. Regular exercise is extremely helpful. Physical activity improves blood flow, increases testosterone, and boosts energy levels. Even 30 minutes of walking daily can make a big difference. Weight management is another key factor. Excess weight increases insulin resistance and lowers testosterone. Losing even a small amount of weight can improve libido. Healthy diet also plays an important role. Focus on vegetables, lean protein, healthy fats, and low glycemic foods. Avoid excessive sugar and processed carbohydrates. Stress management is equally important. Chronic stress raises cortisol levels, which reduces sexual desire. Relaxation techniques, breathing exercises, and proper sleep can help restore balance. Hydration also matters. Dehydration reduces blood volume and affects circulation. Drinking enough water supports overall sexual health. Some patients may also benefit from checking testosterone levels, if low. Proper medical management can improve libido significantly. To prevent low libido, Maintain consistent blood sugar control. Avoid frequent spikes and crashes. Stay physically active. Exercise improves both physical and mental aspects of sexual health. Get enough sleep. Poor sleep reduces testosterone and increases fatigue. Aim for 7 to 8 hours per night. Avoid smoking because it damages blood vessels and worsens diabetic complications. Limit alcohol intake. Since excess alcohol reduces testosterone and sexual desire, monitor your mental health. Anxiety and depression are common in diabetes and can lower libido. Regular medical checkups are important. Early detection of hormonal imbalance or nerve damage can prevent worsening symptoms. Low libido in diabetes is common, but it should never be ignored. It's often your body's early warning sign that blood sugar is affecting nerves, hormones, and circulation. The good news is that with proper diabetes control, healthy lifestyle changes, and early action, libido can improve. If you notice reduced sexual desire, don't feel embarrassed. Addressing it early can protect your sexual health and overall well-being. Your body is sending signals. Listen to them before the problem progresses. Subscribe for more videos about diabetes, sexual health, and hormone balance.